home hemodialysis right for you? Are you considering home hemodialysis HD as a treatment option for your advanced kidney failure? This method lets you dialyze on your own schedule, even when you're sleeping, but it's not without its challenges. You'll need to stick to strict schedules and be handy with the equipment. Plus, there are some risks involved. Let's talk about this. While it might seem daunting, many patients find that the comfort and flexibility of home treatment outweighs these factors. Your doctor can help weigh in here too, providing personalized advice based on your situation. So let's take a closer look at what home hemodialysis entails, from understanding dialysis itself, examining potential risks, and making a well informed decision together with your medical team. You might be wondering about who I am and why I'm qualified to talk about this. If you're someone living with chronic kidney disease, I've got great news for you. Hello, I'm Mathea Ford, a registered dietitian nutritionist specializing in chronic kidney disease and owner of renaldiethq.com. I specialize in helping people just like you improve their health by making simple yet delicious changes to your meals. Together, we can transform your eating habits, boost your overall well being, and ensure that you're enjoying every bite along the way. Say goodbye to bland and boring meals and say hello to a healthier, more vibrant life. Let's get started on this incredible journey to better health together. Visit renaldiethq.com today and take the first step towards a healthier lifestyle. Once your chronic kidney disease progresses to end-stage renal disease, also known as ESRD, treatment modalities known as renal replacement therapies like dialysis therapies or renal transplantation are required to replace your lost kidney function. To fully grasp whether home hemodialysis is the right choice for you, it's essential to understand what dialysis entails and how it functions as a replacement for your kidney's functionality. Dialysis works by filtering your blood to remove waste, salt, and excess fluid, which are normally expelled naturally by your kidneys. There are two types of dialysis, peritoneal and hemodialysis. The former uses a solution in your abdomen to draw out waste, while the latter involves passing your blood through a machine outside your body for cleaning. Either type of dialysis has their pros and cons concerning patient eligibility, financial considerations, lifestyle impact, and caregiver involvement. Hemodialysis is a medical procedure that involves filtering and purifying a patient's blood outside the body. During the procedure, your blood is pumped through a dialysis machine, which contains a specialized filter called a dialyzer. Within the dialyzer, the blood passes through the semi-permeable membrane, allowing waste products, excess fluids, and toxins to come out, and the cleansed blood is then returned to the body. Hemodialysis typically takes place at a specialized clinic or hospital and is performed multiple times a week, usually lasting for a few hours per session. This procedure helps replace the filtering function of damaged or compromised kidneys, effectively managing the waste buildup and maintaining proper fluid and electrolyte balance in individuals with kidney failure. Home hemodialysis is an advanced method that offers improved quality of life and greater control over treatments, but requires careful thought about these factors. It provides flexibility with dialysis schedules, thereby reducing interference with daily activities. However, one must consider if they're willing or able to commit to strict schedules or possess the necessary manual dexterity required for the procedure. Caregiver involvement is also important, as complications can occur requiring quick action. Hence, having someone trained nearby would be beneficial. Weighing all these factors will help you make an informed decision on whether home hemodialysis aligns with your lifestyle needs without compromising your health goals. Let's talk first a little bit about peritoneal dialysis, which is a treatment option you can manage all by yourself and even take on the go. One of the significant benefits of peritoneal dialysis is the level of independence it offers. You have a more flexible treatment schedule, no more trips to the dialysis center 3 times a week. As one of the home dialysis options, peritoneal dialysis gives you the freedom from strict dietary restrictions and less reliance on medications. The process uses your body's natural filtering system and requires no needles. Blood never leaves your body. This could mean fewer side effects. With respect to diet, home peritoneal dialysis could potentially offer more food freedoms due to longer or more frequent sessions, reducing the toxin buildup in your body. As for medication, many patients find they need less when transitioning from in-center hemodialysis to home-based treatments. We shouldn't forget the other perks of home peritoneal dialysis, like convenience during travel or compatibility with daily schedules without sacrificing health management capabilities. Let's take a little closer look at hemodialysis. Hemodialysis and peritoneal dialysis are both life-sustaining treatments for individuals with ESRD, but they differ in their approach and benefits. Hemodialysis offers distinct advantages over peritoneal dialysis in certain aspects. Efficiency of toxin removal. Hemodialysis is highly efficient at rapidly removing waste products, toxins, and excess fluids from the bloodstream. The use of a dialysis machine with a large dialyzer, which acts like an artificial kidney, allows for more thorough cleansing of blood during each session, which can be particularly beneficial for patients with higher toxin levels. Frequency and duration. Hemodialysis sessions typically occur 3 times a week, each treatment time lasting for several hours. While this may require more time commitment than peritoneal dialysis, the less frequent sessions can provide more stable and consistent toxin removal, reducing the risk of fluid and electrolyte imbalances between treatments. Medical supervision. Hemodialysis is performed in a specialized clinic, the hospital dialysis unit, or a dialysis facility under the supervision of a dialysis care team. This controlled environment ensures that dialysis patients receive regular monitoring, immediate medical attention in case of complications, and access to expert care. Suitability for some health conditions. Hemodialysis is often recommended for patients with specific conditions such as heart issues or fluid overload, where rapid and efficient removal of excess fluid is crucial. Patients with limited ability to perform peritoneal dialysis exchanges due to physical limitations may find hemodialysis a more feasible option. In contrast, peritoneal dialysis offers benefits like greater flexibility in treatment location, less dependence on machines, and potential preservation of residual kidney function. Ultimately, the choice between hemodialysis and peritoneal dialysis depends on individual patient factors, lifestyle preferences, and medical considerations, with both modalities aiming to help you live active lives even with ESRD. Okay, let's talk about in-center hemodialysis. Navigating the landscape of in-center dialysis treatments can be a challenge, but understanding what to expect can make a world of difference. There are both advantages and challenges that come with this treatment option. The primary advantage is the professional oversight of the dialysis team provided during each session. Safety measures are strictly followed, ensuring your well-being during treatments. The dialysis machines used are state-of-the-art and maintained by skilled technicians who monitor your progress throughout each procedure. However, the experience of being an in-center hemodialysis patient also includes facing certain challenges. Traveling to and from the center several times a week can be taxing, taking a toll on your time and energy. These visits may interfere with your work or personal schedule, adding an extra layer of stress. Further, while in-center treatments offer safety benefits, they also limit your control over the process compared to home hemodialysis options. This could potentially impact your comfort level during treatments. Understanding these factors will help you gauge whether in-center hemodialysis aligns with your lifestyle needs and preferences. Remember, it's not just about choosing a treatment, it's about choosing what's best for you as an individual living with kidney disease. The flexibility of dialysis at home is truly unparalleled. You can set up a schedule that suits your needs and lifestyle best. Imagine not worrying about transportation or hours spent at the center anymore, and instead spending time with family. The independence granted by home hemodialysis is another distinct advantage. With proper training, you become an active participant in your healthcare journey rather than just a passive patient. This autonomy often leads to better adherence to treatment plans and improved outcomes. The biggest advantage of home hemodialysis is certainly a greater quality of life and control over your own treatments. Home hemodialysis, while still requiring a strict schedule, allows the patient a little more freedom and comfort. With your doctor's permission, patients can choose to do long treatments 3 times a week as they would in a treatment center, or they could choose to break up their treatments into more frequent but shorter shifts. At home, hemodialysis can even be done during the night, also called nocturnal home hemodialysis or nocturnal HHD, when the patient's sleeping. Because the patient is able to control the treatment schedule, a custom treatment schedule is possible. Home hemodialysis is also becoming more and more popular, so smaller machines and easier setups are available. A home hemodialysis setup may or may not be covered by your insurance provider. Your doctor and the distributor of the machines will be able to help you determine the costs. Home hemodialysis offers many advantages to patients, but also comes with risks. You need to weigh these risks with the benefits to decide if home hemodialysis is right for you. There are some requirements for self-administered home dialysis. Home hemodialysis offers patients the flexibility to undergo dialysis treatments in the comfort of your own home. However, specific requirements are necessary to ensure the safe and effective administration of home hemodialysis. A treatment space, a designated clean and well-ventilated room or area is needed for conducting dialysis treatments. This space should be free from potential contaminants and equipped with adequate lighting. Dialysis supplies and machine storage. Adequate storage space is essential for keeping dialysis supplies in the dialysis machine. Storage area capable of holding up to 6 weeks worth of supplies is recommended to ensure uninterrupted treatment. Depending on the chosen therapy option, a care partner might be required to assist during treatments or be present in case of emergencies. Their presence can provide a sense of security and assistance as needed. Treatment setup. A comfortable chair or bed for the patient to use during the treatment is necessary. A proper electrical outlet set up by a technician is required to power the dialysis machine. Good lighting in the treatment space is essential for clear visibility during the procedure. Water source and plumbing. A reliable water source must be accessible for preparing dialysis solutions. Additionally, plumbing is needed to drain used dialysis fluids safely. Communication. A telephone or cell phone should be nearby so that patients can easily make a call during treatment if they require assistance or experience any issues. Before initiating Home HD, a nurse and technician will visit the patient's home to assess the suitability of the space and guide them on proper setup. Ensuring these requirements are met is crucial to conducting safe and successful home hemodialysis treatments, enhancing the convenience and quality of life for patients managing their kidney health at home. Home hemodialysis offers convenience, but potential risks require attention. A lot of these risks are the same as the risks associated with receiving treatment in the dialysis center, but are heightened by the expertise and training of your caregiver. Infections are a significant concern due to the artificial access point needed for dialysis, providing a route for bacteria into the bloodstream. Vigilant hygiene practices and immediate antibiotic treatment for infection symptoms are required. Hypotension or low blood pressure is common during dialysis. Rapid fluid removal can cause symptoms like nausea, vomiting, and fainting. Severe drops in blood pressure increase clot risk and may lead to serious complications like stroke or heart damage. Adhering to fluid restrictions and proper monitoring can mitigate this risk. Electrolyte imbalances can result from dialysis removing needed electrolytes. Hypokalemia or low potassium can cause muscle weakness, heart palpitations, and even cardiac arrhythmias. Proper diet and treatment adherence help prevent these imbalances. Fluid overload is a concern if fluid removal isn't calibrated correctly. This condition can lead to headache, shortness of breath, and swelling, putting strain on the heart and potentially causing heart failure. Dialysis disequilibrium syndrome, although rare, affects newcomers to hemodialysis. It results in cerebral edema and presents symptoms like weakness, dizziness, and changes. In most cases, this condition resolves as the body adapts to treatment. While home hemodialysis offers comfort, patients and caregivers must be aware of potential risks, strictly adhere to protocols, and communicate closely with healthcare providers to mitigate and manage these risks effectively. Transitioning to hemodialysis isn't a decision to be taken lightly. It's crucial that you weigh the pros and cons carefully. Home hemodialysis offers independence and flexibility, but also demands discipline and responsibility. Training requirements are a significant part of this process. You'll need to learn how to operate the dialysis machine effectively, handle any potential emergencies competently, and ensure that your treatment area remains sterile at all times. This can seem daunting, but with commitment and support from healthcare professionals, it's completely achievable. Lifestyle considerations play a major role in this decision as well. While home treatments offer more freedom for work or travel arrangements, they also require dedicated space within your home for equipment storage. A cost analysis is equally vital before embarking on this journey. Although many insurance plans cover home hemodialysis treatments, there might be additional costs involved, such as utilities or house modifications for a dialysis setup. These are some questions you want to ask yourself and discuss with your doctor. Do you dislike or are often unable to make it to an in-center treatment facility? Are you and a loved one or friend willing and able to complete training for use and operation of home hemodialysis machines? Are you and that loved one or friend willing and able to complete training for detection and subsequent action might be necessary if any complications should occur? Or if not, would you be willing and able to hire a nurse to administer your home treatments? Do you and your chosen partner have the visual and manual dexterity to complete the tasks as shown to you by your trainer? This includes, but not limited to, the handling and insertion of needles and catheters, reading directions and paperwork, and filling out order forms. Are you willing and able to abide by a strict schedule for treatments? Are you able to follow directions closely? Are you comfortable asking for help when needed or when you have questions? Do you have any mental disorders such as dementia or depression that would ever deter you from being able to complete treatments as scheduled? Are you aware enough to know if something is different or wrong within your body? And are you willing to and able to call a doctor if such an occasion should arise? Are you confident and motivated to maintain the strict schedule and follow all directions handed to you by your doctors and trainers? If you answered no or are not sure about any of the questions listed above, talk to your doctor. Home hemodialysis can offer you a level of freedom and quality of living that could be more comfortable than a treatment facility. However, it does come with its own risks and responsibilities. Your doctor is the best person to discuss these risks and advantages with. He or she may be able to help you determine if home hemodialysis is right for you. Your doctors are the best people to discuss any reservations or questions with that you might have about your dialysis treatment. So let's talk about consulting your doctor. Don't underestimate the power of a candid conversation with your physician about the most suitable approach to dialysis for your unique situation. Your doctor can provide expert advice on whether home hemodialysis is right for you, balancing benefits versus risks based on your individual health condition and lifestyle needs. Patient suitability is paramount when considering this treatment option. Choosing home hemodialysis requires that medical guidance to ensure suitability and safety. Healthcare providers assess a patient's overall health, kidney function, medical history, and home environment to determine if home hemodialysis is appropriate. Medical guidance helps individuals understand the potential benefits, risks, and responsibilities associated with this treatment option. Trained professionals play a pivotal role in guiding the setup and process of home hemodialysis treatments. These professionals, including nurses and technicians, provide essential training to patients and their caregivers. They teach proper machine operation, infection prevention, access care, and emergency procedures. This comprehensive training empowers patients and caregivers to manage treatments effectively, reducing the risks of errors or complications. Trained professionals offer ongoing support, monitoring treatment progress, and addressing any concerns promptly. Their expertise ensures correct fluid removal, electrolyte balance, and prevention of infections. They also help with troubleshooting technical issues and adjusting treatment plans as needed. Ultimately, the presence of skilled professionals in guiding home hemodialysis offers reassurance to patients and caregivers. Their knowledge and oversight ensures that treatments are conducted safely and effectively, maximizing the benefits of home based dialysis while minimizing potential risks. Home hemodialysis becomes a viable option when supported by a knowledgeable healthcare team, enhancing patients' quality of life and overall well being. Whether or not home hemodialysis is right for you depends on you and your doctor. Deciding on home hemodialysis is a personal journey. You've got to weigh the benefits of and comfort of flexibility against potential risks. It's important to consider your ability to handle it physically and emotionally. Consult your doctor for guidance as they're there to help you make an informed decision. They can provide you with necessary information and support to determine if home hemodialysis is the right option for you. Remember, what matters most is maintaining your quality of life while effectively managing kidney failure. Don't hesitate to discuss your concerns and preferences with your healthcare team. They'll work with you to find the best treatment plan that aligns with your needs and goals.